Okay, so that's us recording now. So, what's happening today is a refresher of listening part A. Apologies for the voice. I've just had the flu, and the flu's gone, but the cough is unfortunately staying. So, it's still affecting my voice. But anyway, we're doing a refresher of listening part A. Uh, Reason is that there's always quite a lot of you, which is unusual, that finds part A slightly harder. And I've seen that recently with some of the discussions that you've had, on the group. So I wanted to touch base with that one, um, because with part B and part C, you definitely can prepare for them by using your grammar skills, okay, and also making sure that you understand meaning behind, the recording that you are listening to. The issue that we have in part A is that you feel that although this is the easiest part of the test, you feel that sometimes you cannot understand the words that you are listening to, or you cannot spell them. Okay. Now, in if you feel that is the issue that you are experiencing right now in listening, the only answer I can give you is you have to prepare, prepare, and prepare. If you do not make preparations in part A, and you always find it hard to listen to words or to spell them out, then it will not improve. Okay? If you want your spelling and your listening to improve in listening part A, you've got nothing else to do other than prepare yourself. The reason why you have to is because there are various different specialization that OET uses in the recording or the two recordings in part A. The common specialization discussed are the ones written in your or the ones that you can see on your screen right now. Now, we've gathered up this list using the materials given to us by OET. So the ones that the sample tests online that students can see, as well as the sample materials given to us and only to teachers. These are the ones that we've had a look at. What are the specializations that are normally being discussed in there? And these are the ones that we found. Out of all these lists, there are five that are quite common. You'll normally see recordings about cardiology, endocrinology or diabetes, dermatology, neurology, and gastro. Okay. Now, if you're someone who's not practice medicine or nursing for a while, it's always a good idea to refresh yourself with regard to the information being discussed during consultations on this specialization. I'm not saying that you go back and understand them all. That's not, okay? Because there are also common information that OET discusses during the 12 questions in every recording, okay? And this information tends to be body parts, symptoms and triggers, the different medical conditions or diagnosis, the different names of testings and investigations, as well as treatment. So when you look at your specialization and you tell yourself, okay, I know what that one is, but I can't remember many of these five information there, then that means go online, go on your medical books, only find out about this five. Okay, because if you prepare yourself with this five information, you are arming yourself with the skill of prediction. Always remember that in listening part A, you will always be listening to a consultation between a specialist and a patient. And when patients speak, they speak these five things: what part of my body is in pain right now, or which parts of my body are affected, what are the feelings that I'm feeling right now, and what do I think has caused them, the triggers. And they may be giving you historical information. I was diagnosed with this, I had this, the doctor thought I have this. And because of that, I was sent to different testing: blood tests, MRI, CT scan, etc. And then lastly, you will hear treatment. When you hear treatment, it's in two parts. It could be home treatment, little things such as an ice pack or a heat pad, or actual medical treatment such as medications, medical procedures, or surgeries. So always remember that when you are listening to recordings in part A, it's always about the patient. And this patient will be talking about those five things. So once you start looking at your question paper, remember that you will be given 30 seconds to look at those 12 questions. Now, 30 seconds is not enough time. Many times, what you do is you hurriedly or in a panic just simply underline, underline, underline. I always say this to students: underlining can sometimes help, but many times it doesn't. The reason is, if you simply just underline and you do not understand what you are underlining, it's a hindrance. It's not helping. Okay? So the very first thing you need to underline is what we call context sentence, which is at the top. The context is the one that tells you what is the specialization of the person or the medical person that you are listening to. In this context, you will hear a GP talking to a patient called Sarah Robertson. Now, because our context is a GP, it doesn't give us a lot of prediction. Why? Because GPs can talk about various different things. So always remember that when you've got a GP as a context, always look for the exact medical condition that your patient will be talking about. And in this instance, it's corneal abrasion on the left eye. Does anyone know what is corneal abrasion? Anyone?
It's the damage of the cornea and eyes. The damage like a tear or yeah, could
Yeah.
be yeah.
Yeah, a tear or a scratch. Yeah. The cornea typically is your eye area. It's the white of our eyes. And of course, if you damage it or you scratch it or you tear it, there will always be a cause. Okay. So when you see something like that, always think about triggers immediately. Oh, okay, they're talking about a tear or a damage to the left eye on the cornea. What could have caused it? Okay, so the corneal abrasion left eye looks like this. Your eye will turn red because you've damaged it, you've tore it, or you've scratched it. Okay. Now, a corneal abrasion is in layman language a scratch. Okay. So you've scratched the cornea or the clear part of your eye, and it's a common eye injury, and it can be caused by some common triggers as well. So number one, our fingernails. We accidentally scratch it, okay? And if your fingernail, especially if your fingernail is quite long, then it will cause a tear or a scratch on the eye. The next one is instead of our fingernail, something else poked it. Okay, when you say poke, it touch, yeah? Or so it could be a hairbrush when we're brushing our hair, Or if you're walking, might be a twig, there was a big blow of air or wind, and something went into your eye. Or perhaps a makeup brush, okay, when we're doing our eye makeup for women. The next one, and this has happened to me, it's because I was wearing my contact lenses for too long. And remember that contact lenses can tear. And when they tear, they do scratch the eyes. So this is a pretty common one, or a pretty common eye problem for those that are wearing lenses. Secondly, if you like rubbing your eyes too much, that pressure could also scratch the eye, okay? And when you're rubbing mild or light, it's okay. But when we're rubbing really, really hard and for too long, it can also cause a corneal abrasion. And lastly, too much exposure to ultraviolet light from the sun. Okay, so if you're looking, that's why when you're looking at the sun, we always say wear your shades, wear your wear your eye protection, etc. So these are the common ones. So always remember when you look at your context, okay, if it's a gastro, it's fine because you immediately see the abdomen. If it's endo, you're always thinking the endocrine. Okay. If it's cardio, you always think, oh, something to do with the heart. But with GPs, very hard. Okay. So once you see a GP context, always look at the medical, the very specific medical condition that they're talking about. So in here, as I've mentioned, the medical condition is the corneal abrasion of the left eye. And as you can see, the very first question in your question paper is the cause. Okay. So the very typical with OET, majority of your answers are common answers. That's why, as I've mentioned, if you prepare, if you understood all about injuries to the cornea, you will be able to answer this as soon as you hear it in the recording. And the next thing that you will need to think about are the headings. So once you know what the medical condition that will be discussed, look at your headings. It's not a case of I'm going to underline this, underline that, underline that. What are you underlining? Okay? So to me, it's not this one that's most important during your 30 seconds of preparation. The more important one is the heading. And when you're looking at the heading, remember the five that I mentioned to you earlier, the one that you have to prepare yourself and be familiar with. Okay. If this is an eye injury, which body part will be affected? Okay. Of course, you will hear the eye. Okay. Um, you will hear maybe lashes. Okay. You may be hearing cornea. Okay. So those are the three that you might hear in there. Then you think about symptoms. And true enough, you can see the symptoms in here. So for the first heading, that's when you will see the body parts. You've got the eye in there and you've got the eye in there. Okay. And symptoms, the Sarah said it feels like there's a foreign body on my eye. Okay, my eye is this one. My eye began to do this, and my eyes are in tears. Okay, so these are the symptoms. So if you remember, if this is something that has happened to you, has happened to a patient of yours, or a family member, you will know that all these four bullet points are common symptoms and common body parts in a cornea or eye problem. When you look at the patient concerns means worries or anxiety. So, what do you think someone who's injured their eye, what would be their worry or their concern? Anyone?
It's a problem with the vision, loss of sight, or yeah,
Yeah, they
a
might
lot of
worry that,
things.
yeah, they might worry that, I might lose my sight. Am I
Yeah.
going to go blind? Okay. So blind vision sight will be the ones that you will hear in this. Okay, that's a very common concern. The other common concern could be another medical condition, the possibility of developing whatever this is. Okay, and this could be a medical diagnosis. And as you've mentioned, vision loss. Now, when you think of vision, think of synonyms. Sight or blind would be synonymous to this one as well. Once you've done that, look at the rest of your headings. This one is ocular history or eye history. We've got allergies and we've got background. Now, if it's an eye history, there will be things that you can predict as well. And as you can see, we can predict the word myopia, okay? That is a diagnosis. And then she said she usually wear this. She occasionally wears this, and she has regular blank. So if you're someone who wears, glasses or contact lenses, then you might think that maybe 17 could be glasses or contact lenses. 18 could be glasses or contact lenses. Okay? So there are two things you can predict already. And for someone who wears glasses and contact lenses, what do you normally have? Regular. Okay? So this could be testing or this could be a treatment. So think about it. Many of us wear glasses, many of us wear lenses. What do you normally do? When you go into allergies, again, something that you could possibly predict, okay? Or even if you can predict this using your medical knowledge, once you hear the allergies, it would be easy for you to remember, okay? So we've got rash, okay? It mentioned latex. So apart from rashes, using your medical knowledge, what other symptom do you think a person who uses latex could develop? Okay, if someone takes penicillin or amoxicillin, what would be the side effects, etc.? And then lastly, the background. In the background, this is very personal to your patient. This is not something you can predict. So when we come to background, you really need to make sure you are listening very, very intently and you are not distracted. Why? Because the information you will find here, the 3 bullet points, could be all about the personal information of your patient. In this example, number 22 is a bonus because it's a symptom or a trigger. So this is something you can use your medical knowledge with. I always say medical knowledge because, as I've mentioned earlier, prepare, prepare, prepare. You need to make sure that you are familiar with the common specializations and the 5 information contained that typically comes up in your Part A questions. The body part, the symptoms, the testings, the treatments, and the diagnosis. If you can prepare these well in advance, you are armed with medical knowledge. Then from question 13 to question 22, it can help you predict or it can help you listen much better. The only times you cannot do that will be in 23 and 24 because these two are personal to your patient. So another thing, apart from making sure that you are prepared within the 30 seconds, is to make sure that you understand the difference between medical and layman language, because your question paper is written in medical form while your recording is recorded in layman language, typically. Okay? So what that means is that in your question paper, we see the words corneal abrasion left eye. In the recording, the GP said, the nurse has just informed me that you're here with a scratch on your left eye. Is that correct? Meaning, as soon as you hear this, it means that the recording is now on bullet point number one. And when you look at the next bullet point under patient symptoms, you see the words foreign body sensation, medical language. What does that mean? Sensation is feeling. So when a patient speaks, they use the word feeling. It feels like there's something in there. Something in there means there's a foreign body. There's something in my eye. I can feel something in my eye because normally we don't. Okay. And when we feel there's something in our eye, it's normally described as foreign body. Okay. And the word sensation is feelings. Now, the word developing, okay, again, a medical language or an academic word, it typically means get. I think I might get. I'm worried that I might get. I'm worried that it will develop. Okay. And then vision loss, as I've mentioned, could be the word blind or sight. Okay. These are the most common ones in there. Myopia means the patient is nearsighted. Okay, so this is something you might not be familiar with. So if your one of your weakness is you're not very familiar with eye injuries, this would be a good one to think of. I think someone just came in. Let me just okay. Okay, that's fine. Okay, so myopia means nearsightedness. Adolescence, again, not something that patients speak. They normally will say in my teens or when I was a teenager. Okay, the word occasional, a bit academic, it simply means the patient might say, I don't wear it all the time. I only wear it from time to time. Oh, yeah, I do wear it, but not all the time, only sometimes. Okay, so as you can see, your question paper is typically written in medical form or academic, while your recording is in layman language. So the word regular, you might hear daily, consistently, normally. Okay, these are the words. And then for 20 and 21, you hear the word develop again. Again, that means get or got or experience. Okay, occasional means sometimes. Occupation could be my job is, I work as. And then in here, weekly, you could hear as every week or every 7 days. Okay, so always arm yourself with the knowledge of what are the layman equivalent of medical words. So for those that still have access to our online materials, if you go on to your listening lessons or listening courses, there is a PDF in there. There's actually two of them that you can download. Okay, and that PDF is your medical versus layman words. We've looked at the most common ones that are being used in listening part A. So those two PDFs will be quite good for you. So if you still have access to the SGR learning management system or the training online, you have those two PDFs under your listening section. Okay, so let's now practice. I've told you about, how to make preparations well in advance, not just, only on the exam. You really need to make sure that you're familiar with the specializations and the five information body parts, symptoms and triggers, medical conditions or diagnosis, testing and investigation, and treatment. Okay, so if everyone's ready, can you please have pen and paper ready? Write down question 13 to 24. Okay, and we're going to do our practice. Okay, so if everyone's ready, here's question 13 to 24. Wherein a GP is talking to a patient called Sarah Robertson. Okay, The context is corneal abrasion of the left eye, or the patient scratch her eye or scratch her left eye. So, because that is your context, think about what would be the typical cause or trigger of a scratch or damage to the eye. Think about what the patient will feel, the symptoms, okay? Think about the common testing and investigation. Think about the common treatment and any medical diagnosis that is related to the eye. Okay, so if everyone's ready, here is our recording.
So, Sarah, the nurse has just informed me that you're here with a scratch on your left eye. Is that correct?
Yes, it's quite painful.
Have you taken any pain relief for it?
Not yet.
Okay. While I'm having a look, can you tell me how this happened?
Well, it was my little boy's fingernail, actually. We have a 2-year-old, and I was in the park trying to put his coat on. It happened when he pushed his hand through the sleeve. It's my fault, really, because I should have trimmed them days ago, but every time I try, he rolls his hand into a fist and refuses to let me near them.
He's definitely scratched it. It looks to me to be a minor abrasion, which is good news. I'll be able to give you some lubricating drops to keep it moist and comfortable while it heals.
Are you sure, Doctor? It feels like there's something in there. My vision is different somehow, and my eye seems to be really sensitive to light now. I had to cover it with my hand. Also, while I was in the waiting room, I noticed that it was starting to twitch, like it was trying to get something out. And now, as you can see, things are just pouring out.
It may feel larger than it actually is, and the symptoms you describe are quite common, even for the most superficial abrasion.
Because a similar thing happened to a friend of mine. It wasn't from her child. I think she was gardening and somehow scratched her eye. She ended up getting an ulcer. I definitely don't want something like that. And that's really worrying because she ended up losing some of her sight. It's been troubling her ever since.
Let me assure you, complications such as the one your friend experienced typically only occur when a very deep abrasion is left untreated. Do you have any history of eyesight impairment?
The funny thing is, I'm nearsighted, so I've been wearing glasses my entire adult life. I'd have had them on today, actually, if I hadn't left them at home on the coffee table. Sometimes I even wear those coloured contact lenses because, as you can probably tell, I have one green eye and one's a greyish blue. I feel a bit juvenile wearing them, but maybe if I'd been wearing those today, I'd have had at least some protection. I've been with the same optometrist for 6 years now, and I go for 6 monthly checkups.
Okay. Well, I'll prescribe you some antibiotic eye drops just to ward off any infection while your eye's on the mend. Do you have any allergies or illnesses I should know about?
I know I'm definitely allergic to penicillin and amoxicillin because the last time I had either, I broke out in a terrible case of hives all over my body. It lasted for hours. I didn't have any other symptoms, but the doctors told me to avoid anything in the penicillin family. Also, when I was 22, I went to hospital just for a gastroscopy, nothing serious. And they found that I have an allergy to latex. Their gloves caused a red rash and even some blisters around my neck.
Any medication?
Not at the moment. I was taking something for sciatica, but I haven't had any pain for a while.
Will you be needing a certificate for work?
I'm a full-time homemaker, so no certificates needed for that. The one thing I guess I'll have to hold back from, though, is my aqua aerobics class every Wednesday. Will I have to stay away from the pool, Doctor?
I'd recommend it until your eyes had a chance to fully heal, at least. And now, before I give you any other...
Okay. So hopefully, preparing or discussing it prior, has helped you listen better in terms of listening part A. Okay, so let's find out the answers. If there are any issues with spelling, please do ask me. You can type it on chat, or if you don't mind mentioning it online, then that's fine. Okay. So let's go for number 13. It's fingernail. Okay. So if you remember the story, she was trying to put on the jacket of her son and she forgot to trim the fingernails of her son, and it's the one that scratched her eye. Okay. And
Sorry,
then
Grace. Is it incorrect if write it separately, finger and nail?
it will be considered incorrect
Okay.
because fingernail will be considered as a basic word by OET. Okay, so now the good thing is you will remember that fingernail is one word only. Okay, so just one word. So number 14, sensitive to light. OET will also accept light sensitive. Okay. So is there any other answers that you would like me to check? So again, sensitive to light or light sensitive. For number 15, twitch. This might be a word you've heard for the very first time. Okay? Twitch means the eye just keeps moving voluntarily. You cannot stop moving. So that's called twitching. Okay? And then for number 16, ulcer. Okay, this was an easy one. She was talking about her friend who had a very similar problem as her, and she talked about what her friend had, each ulcer, and she says, I don't want that to happen to me, which means that is my concern. Okay, and then 17 and 18, we predicted this. 17 is glasses. But 18, most likely some of you might only get two words, but she actually mentioned complete three. Colored contact lenses. If you only answered contact lenses, wrong. Okay, it has to be these three because she was very specific. If you remember the story, her eyes are of two colors. Okay, one blue and one green, if I remember right. So she says she wears colored contact lenses to make them the same color. Okay, so it has to be these three. And because she wears glasses and she wears lenses, she has regular checkups. And if this is something that you do, just like me, I wear lenses, I wear glasses. Uh, you know, I come and see my. I don't think I do 6 months. I think I'm normally like 9 months to 12 months when I come and see my doctor. And then for number 20,
Sorry,
hives.
sorry, Grace.
Mhm.
Checkup is incorrect, just without S.
Yes. Why? Because of the word regular. What does regular mean? All the time, which means it's plural. Yeah. So checkups. Let me think about it. Has regular checkup? Yeah, I will accept. I will accept because it does say every 6 months. And when you say every 6 months, that's typically just considered one. Okay. Yeah, that would be fine, Dr. Shah. Check up. Okay. So and then 21, sorry about that. This is latex and that is blisters. Okay. So hives for number 20, 21 for blisters. Um, and then 22, sciatica. Okay. Now, the word sciatica, to be honest with you, I've heard so many times in listening part A. So, if this is something you're not familiar in terms of spelling, I would want you to remember the spelling now. Okay. Because as I've mentioned, I've seen this so many times in a listening part A answer. The occupation, homemaker. Okay. One word or two words, it's fine. And then on 24, aqua aerobics. Okay. So is there anyone that got 10, 11, or 12? Okay. You can message me or you can mention it in here. Okay. 10, 11, and 12. Okay, these are our targets. So if you got anything below 10, try and ask yourself, is it because of spelling? Okay, or is it because I really didn't hear it, I left it blank? Or was it a cause of um, grammar? Okay, so that's something that you've got to think about. So hopefully those two strategies has helped you today. Again, number one, make sure you prepare yourself, because 30 seconds of preparation when you are actually on the exam is not really helping much. If you want to help yourself and get a higher score of 10, 11, or 12 in every recording, make sure you prepare now. Find out all about the common specialization that OET uses in the recording, and then find out about the 5 information: body parts, triggers and symptoms, medical conditions or diagnosis, testing and investigation, and lastly, the common treatment. And as I've mentioned, make sure you are prepared for the layman equivalent, because what you are going to see in your question paper will not be the same words that you will hear in the recording. Okay? So thank you very much, everybody, for attending today. Take care and have a good weekend. Okay? Bye for now.
Thank you so much. Thanks a lot.
Thank you, Miss Grace.
Thank you, Lola. Bye for now. Thank you,
Thank
Dr.
you.
Cha.
Thank you.
Okay,
Thank you.
bye.
Bye.